There are many things we take for granted in this world. Food, accessible medicine, free Wi-Fi. However, there is one thing that you may not always think of, one of them being your toilet. There are 1.2 billion people who don't have access to any toilets. In Canada, we are extremely lucky to have somewhere private and even enclosed to use the bathroom. There are many places in the world that don't have this luxury. 1.8 million people die every year from diarrheal diseases. 90% of these deaths could be attributed to unsafe water supply, inadequate sanitation, and hygiene. Welcome to Toilet Talk. I'm your host, Janelle.
And I'm your other host, Ashwini. On today's show, we will be talking about sanitation and sanitation marketing in East Java, Indonesia. Before we get to the nitty-gritty, let's give you a rundown of the situation in East Java.
Sitting on the toilet. Sitting on the toilet. Sitting on the toilet. Sitting on the toilet.
Indonesia has the third highest number of people of any country in the world without access to sanitation. Indonesia also has the second highest number of open defecators worldwide at 59 million people. Most villagers are completely unaware of the dangers that open defecation and contact with human feces pose to their health. Open defecation was widely considered socially acceptable, convenient, safe, and clean because feces were believed to be invisible, carried away by water, or eaten by fish.
This poses a threat as inadequate sanitation can greatly affect the health of the citizens. The health of children has become a major concern as the under 5 mortality rate is increasing due to diarrheal diseases, which are linked to inadequate water supply, sanitation, and hygiene issues. In Indonesia, it has been estimated that in excess of 33,000 children die each year from diarrheal diseases, and 11,000 from typhoid, which is a preventable fecal-borne disease. But let's take a step back and talk about the past sanitation issue in East Java. Sanitation coverage was below 70% in urban areas and only about 55% in rural areas. Among the province's 29 districts, the rate of households without toilets ranged anywhere from between 5.6 to 76.4%. Through research, it was revealed that there was a general impression among villages that good sanitation was unaffordable. For those who lacked access to a toilet, one of the most common open defecation practices was to defecate in rivers. To add privacy and convenience, walls were made of plastic or bamboo, and footsteps were made of either wood or bamboo.
The practice of open defecation also commonly occurred in yards, gardens, and ditches. Some of these unsafe practices included WC terbang, which involves defecating on a piece of paper or plastic, putting the feces into a plastic bag, and throwing it into a garden, river, or some other place far from the person's home, as well as WC gali, a term referring to the practice of digging a small hole in the ground to defecate and then covering it up. Children would often defecate in their own kitchens or other areas inside their own homes and would then throw away their feces in yards.
Of the villagers who had access to a working toilet, 51% reported using their own toilets, while 12.1% reported having the ability to share a toilet with a family member or another villager. While having access to a working toilet is an improved situation from being forced to openly defecate, the devices used were often still unsafe and unsanitary for the villagers. One of the toilets used in East Java was known as a jumbling. The main structure was constructed out of bamboo or wood. Plastic sacks were used to function as walls, and PVC pipes were used to direct waste into irrigation canals or rivers. This contaminated the water nearby and exposed the environment to harmful pathogens.
Some residents believe there are positives to practicing open defecation, such as a sense of independence, food for fish, fertilizer to help the growth of the fields, and a reduction in the possibility of smelling your feces. But of course, there are negatives to defecating in public. The negatives that the residents think are things that us Canadians don't even have to worry about. Like about if we need to defecate at night when we are sick or in bad weather. Can you imagine having to leave your house in the middle of a snowstorm because you needed to go to the bathroom? They also find that there is a safety issue with defecating in public, as one of the major locations that people defecate is in rivers. There are children that play near these rivers and there is a chance of them falling into it. It is interesting to see that very few of the residents acknowledge the health concerns that come with open defecation.
We have talked a lot about improved sanitation versus unimproved sanitation, so I think it's important to make the distinction between them known. Improved sanitation is when facilities are privately used by a single household, which have toilets connected to sewers or septic systems, or toilets that flush into covered pits. Unimproved sanitation is when facilities are shared by more than one household and includes systems that do not separate human waste from potential human contact, such as using buckets or going out in the open. In a study done on perceptions about sanitation in Indonesia and Bangladesh, 82.4% of households with private improved sanitation reported feeling satisfied with where they do their business, versus 68.3% who use shared facilities. In terms of cleanliness, 79.5% with a clean latrine reported feeling satisfied, versus only 38.9% who had a dirty latrine. Let's switch now to talk about the Millennium Development Goals created in 2000. Have you heard about these? Well, it's a global partnership to build a safer, more prosperous, and equitable world through the achievement of 8 goals by 2015. One of these goals was to have the proportion of those without access to clean drinking water and sanitation.
Although this goal focuses on clean water and sanitation, sanitation is actually a much bigger problem. In 1990, 65% of the Indonesian population lacked access of improved sanitation, and almost 40% defecated in the open. A lack of improved sanitation increases the likelihood of suffering diarrhea by 23 to 27% versus only 12% from unimproved drinking water.
Jumping to 2010, 46% of the population could only access unimproved sanitation facilities. Jumping even further to 2015, it was estimated that still 39% of the population could only access unimproved sanitation. Although the prevalence is decreasing, the MDG claims it should have been halved, and this was not done. Next up, we will have a guest speaker talking about the sanitation marketing in a, more suitable environment. In response to poor sanitation, there was the creation of the Water and Sanitation Program, which is an international partnership housed at the World Bank. Within this program is a project called the Total Sanitation and Sanitation Marketing Project, or TSSM for short.
The purpose of TSSM was to create an enabling environment, increase demand, and improve supply of improved sanitation and hygiene services. We have Gina here, who's involved with the program, to tell us more about it. Welcome to the show. Please tell us more about this wonderful program.
Hi, thanks for having me on your show. Well, this program supports poor people to obtain affordable, safe, and sustainable access to water and sanitation through active participation of the community. Among many other things included in the program are marketing techniques to change people's views about sanitation. This included the creation of a character called Lil Talek, which really just means uncle. Well, I don't think I can really say the real translation on television, but it's basically uncle something that rhymes with quit. This character is a personification of an open defecation habit. I brought you some examples of the posters. Your viewers can see them as well. If you see, he has flies dancing around his head, a smug smile, and he goes behind a tree to do his business, while onlookers advise him what he is doing is wrong and that he should use improved sanitation facilities. There was also the creation of a WC Ki Sehat, or My Latrine is Healthy, Hygienic, thumbs up sign, and this is used to indicate facilities that meet improved sanitation criteria.
So this all sounds good, but has the program been successful?
Well, compared to more conventional approaches, this program definitely rises above. The project yielded a 49% increase in access to improved sanitation within an 18-month period, comparing to the more conventional methods, which only yielded 10 to 15%. Between November 2007 and May 2009, 325,000 people gained access to improved sanitation facilities in the 21 districts in East Java. 1 year of the program led to 10 to 15 times more toilets being constructed than in the conventional subsidized approaches. I'd say that it's pretty successful, wouldn't you?
Most definitely.
Wow, thank you for coming on our show, Gina. You provided us with some very interesting information. Hopefully this program continues to be successful, and we will definitely want you back on our show for more information.
In our last segment, we'll go over some concluding remarks to finish the show off. Alright, so it is important to remember that diarrheal diseases are one of the most significant causes of malnutrition and nutrient malabsorption. This can lead to impaired physical growth, reduced resistance to infection, long-term gastrointestinal disorders, and long-term cognitive deficiencies.
However, after receiving the intervention, there was a reduction in diarrhea prevalence among the communities. TSSM projects continue to pay attention to monitoring progress and continuous evaluations of results. Therefore, this intervention has had a considerable amount of benefits to the communities in East Java, Indonesia.
Alright, that's all in this week's episode of Toilet Talk. Ladies, join us next week where we'll show you how to get them to put the toilet seat down.